All right, so let's talk about our quick Medicare minute today. Joshua Youngs with Legacy Peace of Mind want to tell you about what to know about the original Medicare Part A and Part B. So, when we talk about our options as we approach age 65 and or entitlement to Medicare through Social Security disability, we want to know we have three options in essence. You can do Part A only, you can do Part A and Part B. You can also do nothing and enroll into nothing. And all three have different positives and negatives and consequences based on what you choose. And this is one of the events that would cause a late enrollment penalty if you don't choose correctly. So let me go through the basics for you. So again, Part A only, Part A and B, or do nothing. Those are our three options. How do you determine that? You need to look at how big the company is that you're working for, whether you're still covered by the insurance, how long you're going to keep working, how much money they're taking out of your paycheck to determine what the overall value is so that you can compare it with what the costs of Medicare are. Our number one advice is always find someone you can trust to guide you through the process. There is no cost or obligation to work with someone like me or someone in our office who's been trained and mentored directly by me. Okay, and so let's get into it. Let's talk about how to get Part A and Part B. So if you're collecting Social Security prior to age 65, 62, 63, 64, then when you reach your entitlement for Medicare or your Medicare age, aka your 65th birth month, you'll be automatically enrolled into both Part A and Part B. So it's an automatic process if you're collecting Social Security. If you're not collecting Social Security, which is everyone else, you have to actually do something to initiate the process. You can go create an appointment, call in and get an appointment with your local Social Security office and go apply in person. You can apply over the phone with Social Security, but the most efficient and quickest way to do so is to go online to ssa.gov/Medicare, create an account, log in, which is something we are experts at guiding people through. So if you need help with that, just let us know. Okay. But again, if you have TRICARE, if you're a veteran, number one, thank you for your service. If you have TRICARE, in order for it to convert to TRICARE for life correctly, you must enroll into Part A and Part B at the time of your 65th birthday and or entitlement month. Otherwise, it will disenroll you from the TRICARE program, which is a big loss for all the effort that you put to earn that. Okay, the standard premium in 2025 is $185 a month. Someone has to pay that premium, either yourself or another entity. So there are programs for those with lower incomes and challenging situations where it is possible to have the state, Medicaid, or some other program pay the $185 a month for you. Also, if you have a higher income, as you can see by the chart here, you will pay a higher income tax as well. Not the tax, but based on your taxes 2 years ago will determine what the premium is that you pay based on the income amount that you have. And so it's really important to understand how that works. But again, they are going to look at your 2023 tax return for 2025 in order to determine what you're going to pay. It's based off of whether you file an individual return or a joint return. And then the income levels again are 106,000 or less or 206,000 or less. That is the categories where you would pay the standard premium of the 185 per month. If you have a higher income, you'll also have an IRMA adjustment on your Part D coverage, whether you do a standalone drug plan or enroll to a Medicare Advantage plan. So that's important to note as well. So as we talk about what is covered by Part A, Medicare Part A covers inpatient services, typically at the hospital, but that could also be through home health care, that could be through hospice, it could also be through skilled nursing facilities. Now, one thing to note with original Medicare, you do have to have a minimum 3-day inpatient hospital stay in order for skilled nursing to be covered. AKA, if you get transitioned to a rehab hospital, there must be a 3 minimum day inpatient hospital stay prior to that being covered. So it's a good thing to note if you stay on original Medicare. Okay, so most people don't have to pay a premium for Part A. It's what's called premium-free Part A. You earn that by paying 40 quarters or 10 years worth of payroll taxes, paying into Medicare, FICA, Social Security, etc., or being married to someone who did. So if you were married for more than 10 years to someone who has a work history, you were a stay-at-home spouse, homemaker, etc., didn't work for whatever reason, disabled, any of that, you can qualify off of your spouse's work history. And for younger dependents who are disabled, they can also qualify off of their parents' work history in certain situations as well. We talk about Part A, what the costs are that are involved. You're talking about a $1,676 deductible, $1,676 deductible that covers you for the first 60 days of hospitalization. Okay, and that's a zero copay on the per day, so that one price would cover you for the first 60 days. If you're in the hospital longer than 60 days, it goes to $419 per day from days 61 to 90. At that point, you would have exhausted your Part A benefit, aka had no more coverage for hospitalization. There are what are called lifetime reserve days. Lifetime reserve days, think of them like a match. Once you burn one, they're gone. So theoretically, if you have all of your lifetime reserve days, the longest continuous hospital stay you could have in one consecutive stay would be 150 days, and those last 60 days would be $838 per day. And again, these are 2025 numbers. These numbers do get adjusted every year. So if you were to exhaust the entire benefit, the number one tip we have is if you need to get Medicare Part A and Part B, do not stay on those benefits by themselves. You do want to enroll in either to a Medicare supplement and a prescription drug plan, or you want to enroll into a Medicare Advantage plan to make sure you're covering your gaps, making sure that you don't have an unlimited exposure point. You're putting a stop loss on things. And on an Advantage plan, you often have co-pays instead of co-insurance as well. Okay, so that being said, if you had no other coverage other than original Medicare Part A and you stayed in the hospital 150 days, your total out of pocket would be almost $63,000 for that one hospital stay. And you would keep incurring costs throughout the year if you were rehospitalized for other reasons or other varying factors, including your Part B expenses, which also have no limit on the out of pocket you can have. But in a nutshell, Part A, very good, strong coverage, covers most of the hospital bill, doesn't have a cost as long as you worked 40 quarters or someone else did, and enrollment is very easy through Social Security's website, ssa.gov, again, ssa.gov/Medicare. When we look at Part B is an 80-20 model. The problem with Part B is after the $257 deductible, the 80-20 goes to infinity. And so infinity is a really big number, and that could be a life-changing event. If something like that were to happen to you, you would deal with a much larger out-of-pocket event than you expected if you had Part B by itself. So again, our high recommendation is do not do Part B by itself. You want to either add a Medicare supplement plan or you want to get a Medicare Advantage plan in addition to that. Medicare does stop at the border, so if you like to travel outside the country, no matter where it is, even if it's 2 steps across the border, just know your Medicare did not follow you most likely. And if it did, it's very limited coverage and or has a bunch of hoops to jump through. So our other recommendation would be for those leaving the country to add a travel policy to your travel plans, as it's very inexpensive and helps fill the gaps that you would leave once you leave the country. We talk about what does Part B cover. Part B covers all your outpatient services. Most of this would be like doctor visits, specialist visits, your primary care doctor, your heart doctor, your back doctor, your lung doctor, your bone doctor, your butt doctor, you name it, doctor. It's all the doctors, okay? All the doctors fall under Part B. Same thing with durable medical equipment, oxygen, colostomy bags, wheelchairs, glucose testing monitors for if you're a diabetic. Most of the durable medical equipment you'll find, medical supplies, etc., are all going to fall under Part B as well. You have 2 ways to administer medication. One that you self-administer, aka you go down to the pharmacy, you pick up the prescription, you give it to yourself, you shoot it into your body, you rub it on your skin, you put the pill in your mouth. So that's self-administered. That's Part D. Part B drugs would be anytime any of those medications were administered by a medical professional at a medical professional's office or other setting. They want to get paid for their services, and so that would fall under Part B. In addition to having to pay the cost of the drug, you also have to pay the cost of having the drug administered as well. Then you have outpatient services at the hospital. These kind of things would be your MRIs, your x-rays, your blood, your urine, your stool samples. Any kind of diagnostics would typically fall under the outpatient services. Same thing with a lot of surgeries nowadays and other procedures. A lot of stuff falls under Part B, outpatient. So again, outpatient. It's not whether or not you stay overnight at the hospital which determines it. There is a legal order signed by the physician, aka similar to like getting a prescription to staying in the hospital. That's what would dictate you to be inpatient versus outpatient. You can sleep at the hospital for several weeks in a row and be classified as observation, and that would fall under Part B, not Part A. And so that's your quick 10 minutes or less lesson today on what is Medicare Part A and Part B. What should you know? What should you watch out for? Again, the costs are pretty static depending on what your income is. There's help if you have low income, and you pay extra if you have high income. Whether you should sign up or not, you should talk to a professional who can help you evaluate your options. If you just talk to HR, they have to give you the blanket response, and they're limited in experience, knowledge, and the right stuff to be a biased opinion towards you. Reach out to someone like us. Again, click the button below. get a hold of us. We would be happy to help guide you through this complicated maze. Hopefully this gave you a little bit of information to help formulate the foundation of knowledge that you need to make an educated decision. Thank you for tuning in. Joshua Young's The Medicare Machine at Legacy Peace of Mind Studios. Over and out.